Okay, so I've arrived on scene and I'm wearing the appropriate safety equipment. I'm checking for any hazards and there's none identifiable. Also looking at the scene to check for the number of patients and potential mechanism of injury. Ethane report, going to do a quick ethane report. So my exact location is 123 Hazard Street. Type of incident is appeared to have a male patient, 80 years old, that's had a fall. No identifiable hazards, number of casualties is 1, and nil additional emergency services required at this time. General impressions of the patient, so doesn't appear to have any loss of consciousness. AVPU, the patient is responsive to verbal stimuli and appears alert. Comfortable that the airway is clear. Breathing appears normal. It does not appear laboured. Slightly tachy, but again, it's probably just due to a bit of stress. So I'm going to auscultate just to check the breathing. I'm also going to observe the rise and fall of the chest to ensure it's symmetrical and there's no abnormalities there. So moving to circulation, just going to check the patient's cap refill, going to check the radial pulse and skin temperature to ensure adequate perfusion. Going to move to rapid trauma survey there, and then just going to literally go head to toe with the patient. Just ask as I'm moving down any feeling or issues with any pain. So just moving from the head, just palpation, just to see if there's any obvious discomfort for the patient, and then going to move down to the chest. Again, I'm going to auscultate in 4 places just to listen for any internal respiratory distress, and I'm going to percuss if I identify anything. Again, checking for symmetry and to ensure there's no penetrations when the patient had a fall, and checking for tenderness and instability. Abdomen, I'm going to move my way down, do a quick check for tenderness and rigidity, and ensure there's no internal bleeding. Pelvis, I'm going to check there to see if there's any instability or crepitation by a quick palpation. And moving down to the legs, I'm just going to look for any signs of swelling, fluid accumulation, or deformity that might have occurred. Also, the patient had a fall, so I'm going to do a motor and sensory function chest. So I'm going to get the patient to squeeze both my hands and going to get them to lift their knees and push against my hands. I'm going to do a pearl check on the patient as they had a fall, and I'm going to start secondary checks, and while my partner does observations, starting with heart rate, respiratory rate, and blood pressure.